It's not quite 7 a.m. like it was yesterday a.m., but the sun is up and it's not quite as cold. So welcome to the Senate Appropriations on Human Development Subcommittee. And if we could ask Dr. Burke to open us up in prayer here on number 9.
Let us pray. Dear Lord, thank you so much for the opportunity to gather together and do the people's business. Please guide our decisions to make sure they honor you and take care of those that are the most needy among us. In your name, amen.
Thank you, Dr. Burke. We are on schedule today. We have Department of Behavioral Health and Developmental Disabilities, Office of Child Advocate, Department of Human Services, Georgia Vocational Rehab, Department of Public Health, Georgia Trauma Care Network Commission, and Department of Veteran Services. So we appreciate everybody being here today. And Commissioner, if we can go ahead and get started there. I know we always like to abbreviate that, DBHDD. It took me several years to figure out what we were talking about. So, but thank you so much. Let me get your mic on. I think that's it right there. Okay, thank you.
Thank you. Good morning, Mr. Chairman. I'm glad you finally got there, DBHDD. Good morning, and appreciate the opportunity to bring you the amended fiscal year 22 budget for the Department of Behavioral Health and Developmental Disabilities. We're going to work from a very brief paper deck this morning. So what you have in your first couple of slides is just a quick snapshot of the landscape in behavioral health and developmental disabilities that I think really help frame the budget items that we will get into. The first one, I want to go ahead, and you've seen this one before. You have a slide that covers some of the challenges we're facing in our state hospital system. And what you see here is a 6-month snapshot of the workforce challenges, and just a reminder of some terminology that we use there, because when we have workforce shortages and we remain in compliance with quality standards, that means we take beds offline. And what you all are very well aware that has impacts on our service delivery system. The next slide, I have not shown this one before, but I did want to make sure you all knew the point that we have the same challenges in our community-based crisis service delivery system, where we've got workforce shortages, and those cause us to take beds, again, offline. What you see here is a brief snapshot showing you that the last quarter of last year, actually the beds offline has increased in the first quarter of this year, and that's for both children and adult beds. Again, just want to make you aware of that as we move into budget considerations. And the third snapshot slide, I want to show you this. I've mentioned this before. This is a number that you've heard about. On the left side of this busy slide, you see a 24% increase in demand in fiscal year 2021 as measured by calls, texts, and chats to our Georgia Crisis and Access line. So want to make a point of that. I think that's well known and well recognized. Right alongside of that, though, you see a lot of different numbers that represent services being delivered. A really important point that I want to make is that while we're facing challenges across the state and in every area of service delivery, tens of thousands of people are receiving services. And I really just want to acknowledge the support that you have provided year over year means many of these critical life-saving services are still in action. So I want to thank you for the investments that you've made to really allow that to be possible. So with that context, let me go ahead and move into the amended 22 budget. So you'll see I essentially just have 2 slides here. The first slide represents, and I assume this one's familiar to you, these are the statewide and agency-wide changes. As you can see for DBHDD, the statewide changes are in the amount of just over $57 million. That's the cost of living adjustments for state employees. And my only comment here is to pause and to express our gratitude and acknowledge how important these funds are. We've heard this directly from our state employees, particularly across the hospital system. This feels like a recognition of their dedicated public service, especially through the pandemic, and we think this is really going to be critical to retention of our current workforce. With that, I'll move on to the final slide here. And what you see in the House Tracking Report are 5 items that impact the DBHDD budget. So I'll walk through just each of these briefly. The first one is in adult developmental disabilities. The House added $400,000 to one of the providers in our network to support infrastructure operations for Georgia Options. The second item, also in our adult developmental disabilities network, you'll see that the House removed funds here where we were not able to implement a contract due to some challenges around the negotiation of that. The point that I want to make here, I think it's important, is that we don't believe that this withdrawal will have any negative or adverse impact on individuals and families. And the contract work will ultimately move forward. The third item here is in our adult mental health category. And what you see here is a $310,000 enhancement to the Georgia Crisis and Access line. As you know, that's the point of entry, 24/7, every hour of the day, every day of the year. That's how many people are finding out how they can get help or calling in crisis. And this $310,000 is an effort to add additional technical enhancements to our bed board. And I want to just say a word about that. Bed board is the term we use, but what you all should know is that that is actually the electronic infrastructure for how we manage where there are individuals in crisis and where there are beds available. So this is a pretty sophisticated system of matching individuals and beds. Every year we try to make adjustments to this. Now this $310,000 one-time funds to add some technological capacity that we think is necessary, especially in view of the implementation of 988, which I've spoken to you all about before, which is anticipated for July. So these are necessary upgrades, we believe, to keep up with both demand and technology enhancements that are needed. Item number 4 is in our child and adolescent developmental disabilities arena, and what you see here is an addition of $16,875, and that's actually a restoration of a cut from fiscal year 20 for this provider. The final item, item number 5, it says direct care and support services. That's in reference to our 5 state hospitals. And what this is, a $5 million enhancement, one-time funds to assist with much-needed repairs across our hospital system. And I always want to make a point to make sure people understand when I say 5 state hospitals, that's not 5 individual buildings in 5 different cities. It's actually campuses and we actually have about 219 buildings and 856 acres constantly in need of upkeep and repair, and we have some critical needs, and this $5 million will be really helpful for supporting our aging infrastructure across the state hospital system. So that is a whirlwind tour of our amended budget. I'm happy to answer any questions.
Thank you so much. Does the committee have any questions at all? All right.
Thank you for your report. About the 988 interface with the GCAL's line, how are the CSBs going to fit into that whole project, or are they?
Oh, yeah, thanks. Great question. So currently, and actually for well over a year, we've had intensive planning underway. The CSBs are part of that, as is 911, law enforcement, a whole array of folks, and healthcare folks, because this really is going to be a comprehensive implementation that's going to touch everyone. So when I think about what are the CSBs going to do, GCAL is still the one who will be answering the call. But if you remember, there was this rubric: somebody to answer the call, somebody to go out, and then a place to go. And a place to go is really where the CSBs are, whether that's outpatient services or the CSBs actually run the majority of our crisis facilities. So they will be on the receiving end where an individual actually needs a place to go. Does that answer your question?
Yes.
Okay.
Just for everybody's education may be listening to, can you just give a sort of a 30,000-foot view of the 988? I know it's being rolled out in July.
It is.
And that is nationwide. Can you sort of expound on that that's a little bit more in the details? Give us a bigger overview.
Excellent, great and important question. So federal law was passed. This is national law that in July of this year, the 3-digit dialing number 988 will go live. The idea is that it's the 911 of behavioral health emergencies. So there has been a national suicide prevention line, and this is a familiar number to a lot of people, because if there was ever a public story about suicide, they usually pair it with this national hotline. What they want now is for states to be receiving those calls, right? And I think this makes sense, because if there's a live person in crisis, we want to be meeting them with the supports and services that are available in our state. We already receive calls from the National Suicide Prevention Lifeline. Those already come to Georgia, but now it'll be enhanced with this national recognition of teaching Americans to dial 988, and wherever you're calling from, there's going to be an expected local response. So this is a really important enhancement. I feel like it's one of the most exciting things that's happened in my lifetime in behavioral health, of destigmatizing and helping people to understand. Our partners at 911 are very pleased to be partnering with us, right? The idea is they're handling emergencies that are not related to behavioral health, but behavioral health experts are picking up that call or actually going to mobile response when needed, or linking folks with services in the community. It's exciting, but as you imagine, intimidating.
Thank you so much. Any other questions? All right. Thank you, Commissioner. Appreciate your presentation.
Thank you.
The Office of Child Advocacy. Here we go.
Morning, Mr. Chairman and members of the committee. My name is Jerry Bruce. I'm the director of the Office of the Child Advocate for the Protection of Children, which is probably one of the smallest agencies in state government, but one that has a very large mission, which is outlined in the first 6 or 7 slides that you have there regarding our statutory duties. Of course, the largest of those statutory duties and the central reason for being for our office is to serve as an ombudsman for the Division of Family and Children Services, and to investigate complaints regarding failures and shortcomings in the system for children and families who are being served, not just in the foster care system, but who are receiving any kind of services whatsoever from DFACS, and who have received those services in the last 5 years. So it's a very important main statutory mission of our office. We also have some other statutory jobs to provide pre-certification training and for guardians ad litem serving in juvenile courts in our state, providing training for juvenile court intake officers who approve removals of children and so need proper training. We also help coordinate with the Division of Family and Children Services, each jurisdiction in the state's Child Abuse Protocol Committee, and we serve as a clearinghouse for collecting those child abuse protocols and getting them distributed as well. And we also provide third-level foster parent grievance mediations when their attempts to work those out with DFACS alone have not, through the Foster Parent Bill of Rights, have been to no avail. So we have a large mission for a small office, and if you'll go to page, you don't actually have page numbers, but it's the first slide that has a pie chart on it, which is about the 10th slide in your deck there. I think you have the paper copies. This is a review of the last 3 years of our workload, and what we've discovered. I came on in June of this year, when the governor appointed me to take the agency head. And then by the time we got administrative staff in place and began really looking at the operations, we discovered that in the fall, really, that the agency had kind of tilted away from its primary statutory duty of providing this oversight and investigative capacity for children who were touched by defects. And so that was one of my first priorities, is to return the focus of the agency to that very important task. And so when I did that, I started realizing that we were actually collecting data, I think, in a way that did not properly reflect the work that, and sending that data to OPB in a way that properly didn't reflect the work that we were doing and show our commitment to the statutory core reason for being that we have. So what we've done with looking at the 4 investigators that we have in our office currently, that's down from an original number of 7 investigative staff several years ago. We have 4 investigators now full-time, one of whom is on Family Medical Leave Act for the time being, so 3 in the office at the moment. And we're handling about the same number of cases that have been handled since 2019. We had raw reports in 2019 of about 485 cases that we had to look at, whether those were investigated or screened out, passed on to another agency for a referral to fix those problems, something like that. You can see from, if you're on that slide that has the 2019 workforce that's about on page 10, you can see that most of our cases at that time were actually being referred to investigation. So we were actually looking into the meat of those allegations, as long as they fit our statutory criteria, and we were providing, we hope, some useful information to the parties involved in those cases. By 2020, as part of the pivot away from the statutory duty that was going on in this office, we began to screen out large numbers of cases. We were screening out some 60% of our all the cases that we touched in 2020, and by the first 6 months of 2021, we were actually screening out 75% of all the cases that we had. And so when I began to really refine our screening criteria, I knew from my experience as a juvenile court judge and a SAG for defects that we were screening out too many of these cases and that we really needed to take a hard look at our screening criteria. Our workload has now jumped back up to pre-2019 levels because we're taking in a lot more cases than we were. And you can see from that last slide in 2021 that our average investigator caseload has gone to 61 cases per investigator, and that includes an extensive backlog that we're trying to work through. This is something that OPB and the governor's office were not really aware of. We've been working very closely with OPB since we started the pivot back to our statutory duties to try and find ways to support this return to statutory duty. There's a lot more required if you're not screening out 75% of your cases. We need to be in the field, we need to be meeting with people, we need to be doing court observations, we need to be pulling court files. I do a lot of that myself. My deputy does some of that as well, but our investigators too. And we've had some really large cases statewide that have required a lot of resources from us. So because of that, I don't want the impression to be that we were underfunded intentionally, that our work was not seen as important by OPB or the governor's office. I think it was just that our office was not making known to them in the past what we needed in order to do our statutory job, because we had kind of pivoted away from that job a little bit. So we've returned to that. So it's unusual, I think, in an amended budget request to be saying, look, in the middle of this year, we need $246,000 so we can hire some new people. I know that that making changes to technology, allowing us to deploy our folks back out into the field and cover those expenses, and handling new personnel are not always sort of the meat of amended budget requests. But in this case, we feel that our need is urgent enough. Our caseload is overwhelming our investigators, and I don't want to cut back on our ability to investigate these cases and provide resolutions, working cooperatively with DFACS and with other state agencies to provide better outcomes for the children and families in these cases. So we are taking a somewhat extraordinary step of asking for the ability to bring on new folks as quickly as possible so that we can really return to our statutory core duties. So that's a very quick outline. There's a lot of information in these slides. I really hate to sit in a presentation where somebody just reads me the slides that they're presenting. So I know you can read for yourselves. I'd be happy to answer any questions you have about our agency, about our request, or anything else.
Got a question? Okay.
Can you give me a little background on your investigators? What is their qualifications and education required to do that job?
All of our investigators except one came from careers at DFACS. So all of them have been people who have extensive experience with DFACS. They understand, if you, with our friends at DFACS here would be the first probably to acknowledge that DFACS has its own kind of language, its own set of policies and procedures, and it's very useful to have someone who knows that intimately and can pick up the phone and can call a county director or a supervisor or a case manager and put them at ease and say, look, I understand the work you're doing. I've come from a similar background. So all of our folks except for one, and that's someone who has been here for 15 years almost, and he has not had a DFACS background, but he's been doing this work for so long that he knows as much as all the other folks do as well. So we prioritize folks with a DFACS and social services background.
Okay, thank you.
Okay.
Thank you.
Yes.
I just was curious, I'm not as familiar with your agency as some of the others, about who else you work with. Do you work with the court-appointed special advocates, the CASA?
We do.
Advocates,
CASA is one of our primary training and work partners. In fact, one of the first things I do when I get a case, and I should have pointed out that my deputy director and I are both carrying caseloads right now in addition to doing our workload because we're trying to help the investigators with that. When we get assigned a case, one of the first things I do, in addition to looking at the SHINES documentation in the DFACS system, is contact the local CASA program and find out, because I felt when I was a judge that CASAs were some of the biggest bang for the buck in our system, and they often know, I've often been on the case longer than the case manager has been on the case. So we work very closely with Georgia CASA and with the individual CASA programs in each jurisdiction. And in fact, we get a large number of referrals from CASAs.
Any other questions? Sure. You slipped in on me. I didn't even see you there. You're number 3. Thank you, Mr. Leader. Number 3.
Yes, sir. I applaud you for adding the additional investigators, and I think it's well needed. But 6 investigators seems so terribly inadequate from my perspective. I don't know other states our size, how many investigators, I guess, what is the count? What is the ratio? What are we looking to achieve over time? Realize we can't put everything in place that we'd like to do by the snap of a finger.
Yes, sir.
But what is the ratio that we're looking to achieve over time, and what are some of the benchmarks or the standards that we would expect to see in other states or other agencies?
There's actually a set of national standards for child welfare ombudsman agencies, and we are trying to implement those standards as part of our policy now, and some of the changes we want to make are to bring us in compliance with those. So nationwide, an ideal ratio is somewhere in the neighborhood of 20 to 30 cases per investigator. And then there are cases that can be assessed, investigated, and then closed with recommendations relatively quickly, addressing the individual problems in those cases. But there are also cases, and we've got 2 or 3 of these working right now, that require much more in-depth investigation. Those usually go to my deputy director and I. She's a child welfare law specialist and has a lot of expertise in this work as well. And what we hope to do in those cases is not just address the problem in that case, but to use the issues in that case to drive system improvement, to talk with DFACS, to talk with CASA, to talk with courts about ways to get a lot of bang for buck out of those large cases. So we know we can't fix every issue, and we could never fix every issue. But we hope by addressing the pressing issues that come up in individual cases and then extrapolating from some of those larger issues to drive system improvement, to have a kind of trickle-down effect where the system is improved by our work in the larger cases and individual families are remedied in the work in the more routine cases. So different states handle their ombudsman, their ombudsman offices very differently. Many of them are very small, but there are states who have large offices as well. I mean, our office was modeled on offices, I think, in the state of Washington and in Illinois, I think, when we first put ours into effect. And so we started out with a staff of 7 or 8 investigative staff. We had some child advocate specialists and a larger administrative staff. That's been whittled down over the years, and I understand, we have 2008 recession between the time this office was founded and today, so there's a lot of financial reality there. The point that I'm trying to make is that we need just enough to be able to to drive system improvement and deal with the most major problems that we find without having the case managers, without having our investigators drown in a caseload that's overwhelming.
So I was thinking about how many investigators per capita, but you're looking at a different perspective. You're talking about number of cases.
Yes, sir.
Per investigator. So what is our number of cases per investigator? And you may have said this earlier and I missed it. How many cases per investigator are we currently running, and what is the national standard that you're referring to?
So currently, right now, we have 61 cases for each of my investigators.
And what is the standard we're trying to reach?
And the standard is about half that.
Okay. Thank you.
Yes, sir.
Might have some work to do in the budget there. So,
It's good work.
yeah. Thank you so much. Any other questions? Thank you, Ms. Bruce. Thanks so
Chairman,
much.
members, thank you very much.
And next is Department of Human Services.
Good morning, Chairman Watson and committee members. I'm Candace Brose, the Commissioner of the Department of Human Services, and I'm joined today by several members of my leadership team. Right here we have Assistant Deputy Commissioner for Finance and DFACS, CFO Cliff O'Connor, Deputy Commissioner for Finance Demetrius Taylor, and also I have my Chief of Staff Craig Foster and Deputy Chief of Staff Chris Hempfling here with me today. So I'll just go right ahead and jump into the House's proposed changes to the Governor's AFY 22 budget recommendations for the Department of Human Services. For the sake of time, you'll see in each of the respective program budgets adjustments to reflect the Governor's proposed workforce initiatives, including a historic pay raise for full-time benefit-eligible state employees. And on behalf of my entire agency, I want to thank the Governor for including these recommendations, as well as express gratitude for the House's support, because these measures will be life-changing for so many of our staff. So I won't go through each of those individually since they go through each program budget. I'll touch on the other ones that have changed on the House side. Starting with on the Senate tracking sheet, page 13, line 174.2 in adoption services. You'll see a reduction of $2.1 million in state funds due to the availability of a temporary enhanced federal matching rate for adoption assistance. And we can absorb this cut if directed to do so through the legislative process. On the same page, line 175.1 in after school care, you'll see a reduction of $2,363,982 for delayed implementation. Specifically, this new funding was initially intended to put $4,727,964 into contracted services for STEM education and learning loss due to the pandemic. The caption references delayed implementation. It took time for our agency to understand the legislative intent behind this specific appropriation and then to develop the strategy for identifying appropriate contractors. In January, we successfully executed the main contract with United Way for these services, but we can absorb this cut by amending down the existing United Way contract and suspending the related planned expenditures. Going down to departmental administration on page 18, starting with line 180.2. You'll see a change between the Governor's recommendation for a little over $4 million for ongoing implementation of the Patients First Act and the state's integrated eligibility system, Georgia Gateway. I testified in our House Subcommittee that newly filed litigation by the state against the Biden administration and other factors have changed the landscape from when this amount was initially calculated, such that we would not spend it all by fiscal year end. You'll see the reduction there to reflect what we can actually utilize. On line 180.3, you'll see a reduction of $514,871 to reflect workforce efficiencies, which, based on what we've recently learned from House budget staff, was calculated based on vacancies at a point in time, specifically from July 2021 to January 2022, to recognize cost savings. On line 180.4, you'll also see a $2.6 million cut related to $4.1 million in unutilized funds to address programmatic costs associated with high-need youth and reduce operating. We believe that this cut was intended for a different program budget, out-of-home care, which is where we pay for foster families, group home providers, and supplemental supervision, which covers the broader categories of wraparound services for children in state custody, as well as the cost of hoteling, which is a term that we use to reference children who cannot find a placement with a foster family or in a congregate care setting, and therefore they're temporarily placed in a hotel or DFACS office. In my joint budget hearing, I explained how we've been working tirelessly to get children out of hotels and DFACS offices when we cannot find an alternative placement. In the out-of-home care budget in FY22, the Senate added a total of $6.7 million for state officials to try to get therapeutic foster care added as a Medicaid reimbursable category. Unfortunately, the federal government has not approved that plan. We also don't have a timeline for any approval. And meanwhile, we've already contracted $4.1 million of that $6.7 million for supplemental services. And because of how aggressively we've been trying to get children out of hotels and offices, we were on track to use all of this money by the end of this fiscal year. We believe the House intended to cut the therapeutic foster care funds by $2.6 million, but that the cut, again, was incorrectly placed in departmental administration rather than out-of-home care. And if the Senate subcommittee agrees with the cut, we ask respectfully that it be moved to the out-of-home care program budget. If the subcommittee does not agree with the cut, we request that it be removed in the Senate version of the amended FY22 budget. Lastly, on page 21, in Elder Community Living Services, you'll see an addition of $1,496,830 on line 182.2. to assist with a local match for area agencies on aging, which, in addition to the state-funded match, will draw down $37,993,513 in funding from the American Rescue Plan passed last year to serve 5,731 additional clients over the next 3 years with supportive services, congregate meals, home-delivered meals, and caregiver services. For reference, in FY21, our agency served over 40,000 clients with home and community-based programs through our 12 area agencies on aging. And again, that will serve almost 6,000 additional clients with the match. And that concludes my remarks on the House's proposed changes to the Governor's AFY22 budget recommendations for the Department of Human Services. And now I'll gladly take any of your questions.
Questions? Senator Burke.
Thank you, Mr. Chairman. Commissioner, thanks for all the work you and your department are doing on that hoteling issue, working closely with the Senate Appropriations Chair and several of us that feel like that's a significant issue, and certainly we want to encourage our subcommittee to look at that very carefully and make sure we get that right, because I think the citizens are being served in a better fashion, and I think the investment we're putting into that is important and significant. So just know we'll be looking at that real carefully. Thank you.
Thank you.
Thank you, Dr. Burke. Appreciate that. Yeah, that's got to be worked through. We appreciate your thoughts on that. Did you have a question? Okay.
Thank you, Commissioner. I'm just trying to find, you want to move that $2.6 million reduction to the program. I can't find it on here, so can you just say the name of it again?
Okay, give me just 1 second.
Yeah,
180.
out of home care, out of home.
It's on page 23 is where the program budget would be for the reductions, what we believe would have been the appropriate place for the reduction. Instead, it was placed in departmental administration. Respectfully, we would ask that, if possible, the subcommittee actually stick with the governor's recommendation, which would not be a reduction in either departmental administration or out-of-home care, primarily because we are working really aggressively to get children out of hotels and DFACS offices, and that cut would hamper those efforts, even if it is put in the right program budget. We've made tremendous progress since July when I moved over to DFACS, even with the Delta and Omicron variants, which took dozens of placements offline for our foster children. We've been able to whittle the number down. We were averaging 60 to 7 children being hoteled on any given night back in July across the state. We are consistently now in the 40s. We reached the 30s in December, which was the lowest anyone could recall it being. And it ticked right back up at the end of the year, but now we're back down into the 40s, looking at the 30s right around the corner.
Thank you.
Thank you for the follow-up. Any other questions? Thank you, Director. Appreciate
Thank you.
the presentation. Now, Georgia Vocational Rehab Agency.
Just wanted to say thank you for the committee for allowing GVRA to go over their budget for a amended year. Just wanted to introduce myself. I'm Chris Wells, Executive Director for the Georgia Vocational Rehabilitation Agency. Been with the agency since June 16, 2020. And so I don't think I've had the opportunity to speak with the subcommittee on a consistent basis. So we developed a small presentation just to kind of go over kind of where we are, some of the things that we're doing, and then we'll be more than happy to address some of the budget items. If you refer to your presentation, our first slide just shows our expenditure history with the agency. GVRA has approximately a $19 million state funds budget and $175 million total funds budget. And so that first slide just shows over the last, since 2013, what our funding has looked like over time. You'll see the biggest drop there is from 2019 through 2020. That's the exact correlation between the reorganization that took place prior to my arrival, as well as the impact of the COVID-19 on our particular agency. Our next slide, because we're administratively attached to the Department of Human Services, sometimes our total budget gets lost in the total. So if you look at slide 3, we have a breakout of just what our budget looks like from our 5 statutory programs. Again, we operate the Business Enterprise Program. That's our vending locations in a lot of our federal properties, as well as in a lot of our cafeterias. We have Department Admin, Disability Adjudication Services, Georgia Industries for the Blind, and then Vocational Rehabilitation Services. Our 2 largest programs, which is VR and Disability Adjudication Services, operate with approximately about 450 employees there. Our next slide, which is slide number 3, just provides a little bit of breakout of our spending from FY 2021. It just shows our expenditures by object class. Our 2 biggest categories is personal services, and our biggest concentration of personal services is our rehabilitation counselors, as well as our adjudicators with disability adjudication services. And
Mr. Wells, we got the slides. We'll go with
Okay.
our time, but we got 3 more folks to present, and so why don't we just get right to the budget? And,
Perfect.
And we promise everybody here on the committee will promise to review these.
no problem. Well, we'll get straight to it. The House Bill 910 AFY 2020 tracking document. As you can see, most of our changes is associated with the agency recruitment and retention. It supports the 5,000. As you can see there, our agency will definitely be able to accomplish the goal for the 5,000 in the amended year budget. As you can see in 192.1, that includes 193.1. Again, disability adjudication services is all federally funded, so we've already reached out to our federal partners, and they're willing, if the budget passed, to provide that documentation to be able to support our federal employees. You'll see there in 196.1, that 1.5 is the state-funded portion of the VR program, which is funded 4-to-1 or 80-20 match. So that's where that is. And then we have 196.2, which is the 100,000. We started the process last year of moving to an online referral. This 100,000 takes into account the case management system upgrades that are needed to accept the online application during this pandemic. Lastly, you'll see two more ads, 196.3 and 196.4. Those are two ads that the House was able to provide, and those were for the Georgia Radio Reading Service. They had an MOU with the agency as well as with the Statewide Independent Living Council. During the pandemic, those funds were reduced, and so this is designed to restore those funds. And then the last ad I think I omitted was 195.1 to 301,420. That's the Georgia Industries for the Blind. They typically operate with all sales. Due to the supply chain issues, we are unable to support them with the 5,000, and with the help of the House was able to provide state funding to be able to provide the 5,000 for our team down there in our Bainbridge location. So this concludes the presentation. If there's any questions, I'll be more than happy to answer.
Appreciate your efficiency. Any questions from the committee? No. Can we just follow up on the vocational rehab?
Yes, sir.
Industries for the Blind offline after this? Thank you.
Yes, sir.
Appreciate
Do
it.
you want me to hold on, or?
Yeah, if you.
Stop by my office or call and make an appointment or something. I'd just love to spend a few minutes with you.
Yes, sir.
Thank you.
Okay.
Same here, either hang around or appointment in my office.
We'll be more than happy to hang
Thank you.
on.
We're next up, Department of Public Health.
Mr. Chairman, with your permission, may I sit here?
Sure.
Thank you so much. This may sound funny to say, but it's actually wonderful to see you all in person.
Yeah,
It's been a while.
in person.
I've spoken to many of you on the phone, and many thanks for the help you've given me in so many diverse ways in the last year since we were together. I'll be uncharacteristically brief, I hope, because we only have two budget items, which were actually also carried forward by the House. Just very quickly, I'll go through my PowerPoints, but just talk through, again, the department, as you know, is unusually structured with a state office, 18 public health districts that are state entities, health directors that report to the commissioner, and then 159 county boards of health, which are independent but supervised by the district health directors. And the reason I wanted to make that point in this presentation is because the statewide pay increase that we've seen in the governor's proposed budget, and also the carry forward by the House, with the $5,000 pay increase for all full-time benefit eligible. If you look at the breakdown by program, it actually includes that $26,099,22 for county board of health employees. And this is really a tremendous boost for morale in public health as we're working so hard through the pandemic. So every program is going to be affected. Every program is going to get that $5,000, but I wanted to point out specifically that the County Board of Health employees, even though they're not technically state employees, they work under the direction of the district health director, but they too are included, and that's that line that shows 248.1 public health formula grants to counties. Our staff, as you are probably aware, are underpaid compared to other agencies and entities, not just here within within Georgia, like, for example, the CDC pays significantly more for an epidemiologist, but even an environmentalist, where there's high rates of turnover, can get a higher salary working for Chick-fil-A. So we are hoping that this increase will allow us to improve our recruitment and retention of our very good staff. And the last thing I wanted to point out was our second budget item, which is 26.2, the increase in funds to address the shortfall for the AIDS Drug Assistance Program, or ADAP, per the state match requirements of the Ryan White CARE Act. The budget that the governor recommended included over 9.9 million, and the House has also approved that same amount. Now, where did we come up with 9.9 million? That's the state match that is needed to make us whole as a program. It's a critical investment for us, because we are seeing, as you'll see in the subsequent slides, an increase in enrollment in ADAP and the HIV drug assistance program. The South is the epicenter of the HIV epidemic. We've seen this. This is different from where it was in the 80s and even the 90s. And because of that, we have seen an increase in HIV infected individuals throughout our state, rural and as well as metro. And with that, an increasing demand. The pandemic has certainly played a part because of people losing insurance, but I also want to point out that we were the recipients of the End the HIV Epidemic grant from CDC, one of the relatively few areas in the United States that got those grants to increase outreach to identify individuals at risk and to test and then link to care as quickly as possible, which is important not only to treat the individual and stop the progression of HIV disease, but also to stop transmission, because once on treatment, individuals no longer transmit infection. And so by that active outreach, we can identify high-risk individuals and keep them HIV negative, but also once identified, can put them on treatment, which is the purpose of the Ryan White program. And finally, again, looking at the insurance continuation program, same kind of increasing demands that have come. I will say that you at the last year's budget, I think really said to me, you need to really increase the efficiency and the effectiveness of these programs. You need to reorganize. You need to make sure that you're getting the most for your money out of what we have before we will give you additional funds. I'm pleased to say we have done that. We've restructured. We've actually brought in consultants both from HRSA, who run the Ryan White program, as well as from CDC, and to give us an idea of what we can do better, how we can restructure and improve efficiency as well as effectiveness. And we know that, and feel very confident that this 9.9 million will not only make that gap in our state match, but it will keep us sustainable for a number of years forward, even as we actively, as you had suggested last year, work to increase the number of individuals on the HIV insurance program, because you actually get more benefits in some sense for the same investment, because it's a broader coverage than just the drug assistance program, which gives you your HIV drugs but don't cover your other medical expenses. So I did want to point out that we listened to you and have been very actively engaged in reworking the program. We now have a new medical director in the department, and he oversees this program. He's been very, very much engaged in the program. And so with these funds, the program will stabilize. We will not have to have a waiting list, which is very important. And we can continue to grow the program efficiently. And that's the end of my presentation.
Thank you. Question?
Yeah, thank you, Commissioner Toomey. I wonder if you could give us an update on the modernization of the software.
Absolutely. And I have actually for you a summary of kind of where that is. There are actually two specific projects. You awarded to us $27 million total. 16 million in state funds were to go to a new and updated surveillance system to replace an antiquated system that really was a homegrown version that was not built to handle the millions of cases that we are seeing now, cases and tests. And of course, the Registry for Immunization and Transaction. We began that registry immediately. We used 7.5 million of that of the bond monies to design, develop, and implement the VMS, which is actually currently being used now for the COVID vaccine. At the time that we did this, we had intended, and you and I had talked about the fact that we were going to incorporate all vaccines into this. It wouldn't be just a standalone COVID vaccine management system, and we thought that that was one project. We found out after session was over that it was going to be considered as two projects, and so we kind of retroactively had to introduce a business case for that, and that RFP to basically consolidate the now existing COVID vaccine management system, which has really improved our ability at the local level to be able to track vaccine, to be able to order vaccine, to ensure it's in the right place and being used up to date, to combine that with the GRITS system to become the GRITS 2 system, which will cover all childhood immunizations as well as other adult immunizations such as pneumococcal vaccine, shingles, and or even tetanus. So that RFP we expect to come out within the next several weeks. The business case was submitted, and that is currently and the RFP is currently being developed with DOIS and GTA now. The Electronic Notifiable Disease Surveillance System, or SENS, didn't get that jump start that we got during the pandemic work. And so we developed that business case. It wasn't considered a pandemic, as a pandemic procurement, so we had to go through the regular GTA requirements of a business case. The business case was approved, and now that is also residing at GTA with DOIS, and an RFP for that as well will be issued within the next several weeks, certainly by March. And the good news is that it was the specifications for it is many fold bigger than our current surveillance system. So we won't have the problems we had just a few weeks ago with the system kind of crashing because of the weight of the multiple tests, et cetera. And so by design, it was designed to be much higher capacity and be able to handle more specimens daily.
All right, thank you so much for the presentation. Doing a great job. And I know it's been trying over the past, I don't know how long it's been now, a couple
it's
years?
Over 2 years.
Yeah, so
January of
it's
2020, the year of infamy for me.
yeah, I remember you sitting in my office saying, and it was in January, we need to watch this going on in China. Yeah, so, all right, thank you so much for being here,
Okay.
and
My pleasure.
appreciate
Great to
it.
see you all.
All right, next we have Georgia Trauma Care Network Commission. And then we have Department of Veteran Services. I would say we have 6 minutes, but we probably can fudge on that a little bit, but the floor is yours.
Thank you, sir. Good morning, Mr. Chairman and members of the committee. I'm Liz Atkins, the Executive Director for the Georgia Trauma Commission, and I'm joined today by Katie Hamilton, who is our Finance Operations Officer. So we'll be very brief. I know you all know well what our function is, and we're grateful for your appropriations in the past, and a number of our initiatives that we're going to embark on this year really dovetail on what we received last year, because we were able to embark upon our own Georgia-based risk-adjusted benchmarking program for outcomes for injured patients in Georgia. And the very exciting thing about this is that it'll finally give us the window into what's happening in the level 3 and level 4 centers, which are largely rural. We've not had that ability to see what happens to those patients and help sort of drive some of the improvements in care that are needed before those patients can actually get to definitive care. So in addition, we have a huge initiative going on this year with education on military resuscitation concepts that we want to integrate into the rural areas, excuse me, because it's a similar environment in that there are often prolonged transport times. Patients can sit in hospitals for a long time waiting for beds because there are COVID patients occupying those beds. So we've seen a lot of challenges this year. And as you're all aware, unfortunately, trauma did not take a rest during COVID because a number of our centers, overall for Georgia, trauma volume was up in 2020. Just about 5%. Some centers saw as high as 25% increase in trauma patients. We're still waiting for the 2021 numbers to come in, so I don't have data on that yet, but I will. So just to go over a couple of the items here, you'll see that our total of $9.1 million is a little bit higher than what you have in your document, but that's because the Commission considers the prior year's allocation and they use that for planning purposes. So typically what happens, we don't have a vote on this yet. That will happen once the budget is passed. But typically what they do is the two big numbers that you see on the sheet here, which speaks to the trauma center allocation, and then emergency medical services, the 1.6 million, they typically will proportionally reduce those to match whatever the allocation that you all give us. And those monies go, EMS primarily is sort of the vehicle by which we compensate them for their uncompensated care portion through those equipment grants that we do. And then for the trauma centers, that's sort of the true up for that readiness. I know you all have heard Dr. Ashley talk about 10 cents on the dollar for readiness, what the centers get versus what it costs. The additional trauma system quality and accountability initiatives there that you'll see again are just more extensions of some of those data-driven initiatives that we have. Primarily, we really want to get, when the Commission first started, we had an American College of Surgeons system consultative visit. We want to do that again, but there's some things that DPH, OEMS, and T needs to do first in order to get that done. But the American College of Surgeons has agreed to use Georgia as a pilot state to do a rural-focused visit. And again, that'll help us get a window into rural that we would otherwise not happen and figure out what are meaningful initiatives that we can fund in rural Georgia that will really help improve access. And then we want to keep the rural centers able to fund their participation in the National Trauma Quality Improvement Program. We need that national level participation for rural centers in addition to the Georgia-specific risk-adjusted benchmarking that we embarked upon. We have to know how we as Georgia compare nationally, and then we can figure out where the opportunities are within our state. So that sort of summarizes, this is a lot on here, but I certainly would be happy to take any of the committee members' questions.
Any questions? Thanks so much.
Okay, thank you.
Appreciate
Thank
it.
you all.
Notice later in the day, later in the process.
Thanks so much. You know, we were going in alphabetical order, and as I mentioned earlier, DBHDD, sort of those letters get them top of the list, and veterans begins with a V. I'm sorry. So last but not least, veteran services, and I think you're you do have a handout for us, and for the committee, we're in sections 346, if I remember correctly. Yes. Okay. Thanks. Floor is yours.
Yes, sir. Thank you, Chairman Watson, members of the subcommittee. I'm Trish Ross. I'm brand new as the Commissioner of the Department of Veterans Service. Began in 1 December, so I think I'm the newest one on the block, but I appreciate you hearing us today. And based on your previous comments, I know you've got our presentation in front of you, but I'm going to just dive into the budget. A couple of things I did want to mention. I am joined by my Assistant Commissioner for Administration, Health, and Memorials, Mr. Mark Bannister, my Assistant Commissioner for Field Operations and Appeals, Mr. George Canavaggio, and our budget analyst, Kamala Ball. The big thing to take away from Georgia Department of Veterans Service is we do benefits for the VA for our veterans going and applying to the Department of Veterans Affairs, and those are not an entitlement. They don't happen automatically. We have to assist. So we, along with our 49 other states, are the department that helps you do that. And in 2021, we actually directly contributed $3.3 billion into Georgia's economy going into veterans' pockets. That's directly touched by our department. If we kind of just delve into the budget, on page 44, on our administrative budget, you can see, of course, like everybody else, we are definitely appreciative of the $5,000 cost of living increase. We do have very low salaries. Our average veteran field service officer makes just over $13 an hour, so this will go a long way in helping with our attrition. Our attrition actually has skyrocketed this fall to about 40%. We are part of the great migration to other positions, so we appreciate that $5,000. And you may question, we do have a transfer of funds from veterans benefits to departmental administration. That is because of the retirement of the prior commissioner, and that's to align it appropriately to that program, which is where it belongs. Kind of jumping down to the Veterans Memorial Cemeteries, of which we have two, we've seen a significant increase in interments, as you can imagine, with COVID. They have had a very high operations tempo. And they will be appreciative of that cost of living increase. I will tell you, we got an additional cemetery worker in last year's budget that we've not been able to fill. We have a second position that we've not been able to fill, which is why we do have a workforce efficiency number of just over $14,000. We are hoping that $5,000 allows us to be able to hire those individuals who are heavy equipment operators, help do the ceremonies, the burials, as well as keep up the facilities and do the landscaping. So it's a lot of money, or a lot of work for somebody that makes just over $12 an hour. So we certainly know that that increase in salary will help. Moving to our Georgia War Veterans nursing homes, there really wasn't any significant budgetary notes on that other than the increase of the $5,000. That's not only for the staff with Georgia Department of Veterans Service, but our home in Augusta is actually run by Augusta University, so that includes their numbers as well. And then turning over to veterans benefits, page 46, 348 is what I'm looking at. Just a couple of things. Brand new in the department, we have reduced our number of field offices, trying for that efficiency and to be more effective as a department. So we're now down to 49 field offices. We've reduced our itinerants by 6. The bottom line is we are trying to realign our resources. We have 3 community-based outreach clinics with the Veterans Administration coming online that they have asked us to co-locate with them. Of course, that better serves our veterans because we are there when they go to their doctor's appointments. We can get that information from those doctors and use it as far as their claims go. Those clinics standing up are Jasper, Zebulon, and Cobb County. That's through the end of the summer. So we will be shifting positions over there, just so you know, and realigning. In addition, we've had some vacancies in our appeals section, which falls in this program element. We are going to shift some appeals offices to Central and South Georgia. Not everybody can make appeals hearings in Atlanta. This will better serve our veterans. We're doing more virtual hearings, but again, some of our older population just simply can't get to Atlanta, and this way we can get to them and be closer located to where they live. So those are some of the things that we're doing organizationally to realign what we already have. And that also plays into that workforce efficiencies. We do have those vacancies as we are getting ready to realign them over the next year. Overall, as my first year, we're very excited. Again, the cost of living increase, really have no issues with some of the other budget cuts. Will hamstring us a little bit with those workplace efficiencies as we were trying to use our internal lapse rate to create some career progression and move some things around. But we appreciate you listening to me this morning and look forward to your questions.
Yeah. Thank you, Colonel. I want to just point out on the State War Veterans Homes, I appreciate you pointing out that we really could be serving more veterans than we are in that program. So we're going to have a study committee on that in the Senate to just kind of take a look at what we really need to be doing. And now that the governor's highlighted the military retiree income tax exemption, we may have even more need for the facilities that serve our older veterans that need nursing home care.
Yeah.
So thank you for pointing that out.
Yes, ma'am. And if I could, we are scheduled to open our subacute therapy unit, which is designed for mainly our post 9/11 veterans who have post-traumatic stress, traumatic brain injuries. That should be early summer in Milledgeville, so combines not only mental health providers, but physical, occupational, and speech therapy. It's the first unit of its kind owned by a state organization, so we're excited. That can grow to 75 beds, but will not only allow our skilled nursing facilities to help our older veterans, but this will help our younger veteran population actually get the services they need and reintegrate into the civilian workforce.
Thank you so much. Really appreciate you being here and appreciate you being efficient. No further questions. Anything else from the committee?
Okay.
Thank you so much for representing the veterans here.
Thank you
and
very much.
What you do is certainly invaluable. And one note, just to clean up, is the Georgia Council on Aging did have a letter in our folder, so I'd appreciate just your attention to that. And they were not going to testify. With no further business, meeting is adjourned. Thank you.